Most ovarian cysts are harmless and disappear without treatment within a few months. But, as Dr. Samir Hage at Redlands Community Hospital tells us, some ovarian cysts can produce serious symptoms.
Ovarian cyst is a fluid-filled sac that grows on the ovary of a woman. If the cyst ruptures or if it's large enough to twist or turn the ovary and cause blood flow to decrease to the ovary, which is called a torsion, it could cause severe pain. But that's how we usually diagnose them. Most of the times they go undiagnosed.
Dr. Hage discusses the diagnosis of an ovarian cyst.
When we diagnose an ovarian cyst, usually starts with history and physical examination. If the patient is, if I'm able to do an adequate physical exam on the patient where I can feel the organs during the pelvic exam, and I suspect that there's enlargement on the ovary, then I like to confirm that with pelvic sonography, an ultrasound examination. Once you have the history and physical examination and you're sort of leaning towards that way, then you get imaging. Based on the initial imaging determines the type of cyst, if there is a cyst, if it's fluid filled, if it's solid, if it has other components, how big it is, how old the person is, determines what the next step would be. The most common treatment is, depending on the size, observation, depending how symptomatic they are. Then we use hormonal suppression, such as birth control pills, which suppresses the ovarian hormones to stop forming cysts. Sometimes it helps decrease the size of the cyst that's already there. You do that for a short period of time. If the cyst continues to grow, depending on symptoms, age of person, then you can proceed to surgical therapies.
Dr. Hage, how successful is the treatment of ovarian cysts?
The treatment for ovarian cysts could potentially be very successful if certain guidelines are followed. For a benign situation, it's highly successful. Again, depending on modality, if you start with oral contraceptives and take it all the way to surgery, highly successful. And when you start getting into the more malignant stages, the ovarian cancer is usually diagnosed in late stages. Sometimes ovarian cancer starts as a cyst, sometimes it just shows up when it's too late. So highly successful for benign ovarian cysts. And there are, again, a multitude of ovarian cysts, depending on if they are a basketball size and full of fluid, they're most likely benign, and those are usually surgically treated. If they're golf ball size and they have teeth and hair and fat in them, that's usually benign. That's called a dermoid cyst. Usually those are surgically treated. You can't treat those. So again, depending on the imaging characteristics of a cyst. But the majority are successfully treated once diagnosed and followed correctly.